The Explorer probe is a double-ended instrument that's essential for properly diagnosing various problems within the mouth, including periodontal disease and tooth resorption. The Explorer, the sharp tip on one end to look for various dental lesions, and the periodontal probe on the opposite end. Within the kitty, I can use the sharpened Explorer to very gently glide along the surface of the tooth right at the gum line. I'm looking for areas that may be areas of tooth resorption, and I can find that by grabbing onto these roughened areas, and I should feel the instrument catch, and it may give a ting sound when I pull it away from the tooth. The Explorer can also be useful for detecting caries or cavities in the dog. Whenever I see any signs of discoloration to the pits of the molar teeth in the dog, I want to use the sharpened tip here in those areas of discoloration to see if the sharpened tip actually sinks down into the diseased tooth, and when we come out of it, if we truly have a cavity, it may feel like coming out of taffy when we're pulling away from the tooth. The periodontal probe is useful for looking for periodontal pockets. It's graded so that it has every millimeter getting a black line, and every 5th millimeter gets a black band, measuring to 15 millimeters in total. I want to take the periodontal probe and go very gently between the tooth and the gum, measuring the depth of that valley. And I measure that in millimeters. I want to make sure that I don't hurt the attachment to the tooth, and also I don't want to rake along the gingiva here, but be very gentle by probing, measuring, removing, and measuring again. The same periodontal probe can be useful in measuring any evidence of furcation involvement or furcation exposure. I use the probe and I glide it along the tooth surface of a multi-rooted tooth. And if that probe sinks down into that space where the two roots separate, then I have furcation exposure. The Explorer probe is a double-ended instrument that's essential for properly diagnosing various problems within the mouth, including periodontal disease and tooth resorption.